Welcome back to Plastic Surgery Decoded, the podcast where we demystify plastic surgery and provide a foundation for understanding it, whether you're actually considering a procedure or you're just curious. As always, I'm your host, Dr. Regina Nouhan, and in this season number 4, you'll find a new approach, including interviews and covering a wide variety of subjects. But after you listen to this episode, I encourage you to go back and really explore the previous seasons, as they are full of valuable information. You get to pick and choose what to learn about next. Season 1 covers common aesthetic or cosmetic surgery topics and skincare, while Season 2 explains reconstructive surgery topics. Then Season 3 goes over general questions about plastic surgery. Remember that this podcast reflects my experience and opinion, as well as those of any guest interviewed. It is not intended to provide medical advice, nor is it a substitute for a formal consultation with your physician. So stay tuned for this interesting journey we'll take together in the ever-expanding world of plastic surgery. Let's go! The global hair restoration business has virtually doubled in the last 10 years as more and more people, men and women, are seeking improvement for thinning hair or areas of complete hair loss. In fact, the treatment options for this problem have both expanded and become more refined, targeted, and successful. It's fascinating what can be done now, and it's exciting what the future for hair restoration may hold. So in this episode, let's learn all about it from a dedicated expert, plastic surgeon Dr. Kaveh Alizadeh. Listen in as he shares his experience and insight with this topic. Here we go. Well, today we have with us Dr. Kaveh Alizadeh, and now he is a board-certified plastic surgeon and clinical professor of surgery at New York Medical College. Currently, he's in clinical practice in New York City and Long Island. Welcome, Dr. Alizadeh.
Thank you, Dr. Nouhan, and I look forward to spending the time with you today.
This is so great. Thank you for being here. Well, we're here to talk about hair restoration, but could you please first tell us a little bit about your practice in general? Now, you have had a long, successful career in both academic and clinical surgery. What types of patients and cases do you focus on now mainly?
Yeah, so this is my 24th year in practice.
Amazing.
I started my career in mostly reconstructive surgery and being involved in a large plastic surgery clinic here in New York called Long Island Plastic Surgery, and then moved on to academic practice for about 10 years, where I was chief of plastic surgery at New York Medical College. But since COVID, I've really focused on a more boutique practice, mostly with a cosmetic focus. In New York, we have an office on Park Avenue and another one in Jericho, Long Island. And so we're trying to be very laser focused on 5 particular areas. One is natural bra, which is an area of where we're using an internal bra for a breast lift. One is migraine surgery, which is a new and developing area, and plastic surgery for people with chronic headaches.
Yes.
Another is the sort of the whole brand new world that we're going to talk about with stem cells and how they can connect with regards to rejuvenation and scalp and hair growth and so forth, is post-bariatric plastic surgery, and especially now in the wake of Ozempic and millions of Americans who will be having a major weight loss coming down the pipeline.
So needed.
Yeah, and then last but not least is really the complementary areas of medicine with regards to injectables, lasers, and in addition to what we do in surgery, as well as age management with regards to hormone management, sexual health, both for men and women.
Mm-hmm. That's wonderful. It's a really nice broad spectrum of entities that you treat and different types of people that you treat. I think that people love that. And so how did you become interested in hair restoration?
So as my practice has matured in the past almost quarter century, our patients are also, I tend to see older patients over time.
Mm-hmm.
And it started by the interest of our male patients who are mostly in their 40s, 50s, and 60s, who have lost the hair and were interested in having hair replacement. So, some of the newer technologies, now we've gone from the old days of just taking the old doll's hair grafts to now very more advanced, using automated or even robotic systems to be able to take the hair follicles, separate them, and put them in.
Yeah. Much more sophisticated.
Yeah, so that's sort of the classic hair transplant. But what's interesting, the demand has now shifted to the younger population. So I'm seeing more and more patients that are in their 20s and 30s
Ah, interesting.
who have not lost the hair yet, but are noticing thinning of the hair and thinning of the scalp. And some of the newer technologies, as we discussed, like stem cells, have a great place there.
Yeah.
So we have now incorporated that for that population, which is why it's really growing part of our practice,
Yeah.
which brings us to this idea of hair therapy for, mostly men. But there are also women, obviously, who can benefit from it.
Of course, yeah, and we'll talk about that for sure. Yeah, so interesting, the progression of treatment and technology, and we'll talk about that. As we embark on our topic today, could you first just give the listeners a brief understanding about how hair growth works and what the difference is between a hair follicle and a hair strand, just to start with? What is the follicle?
Sure. So think of it as like a root of a tree, right? So the tree is what sticks out, but there's a whole world underneath the earth, and in our case, the scalp,
I love that.
that helps drive that growth, right? So the follicle is sort of, it has its own milieu within the world of the scalp, where it has its own blood supply, where there are vessels that are connected to it. There's actually nerves that are connected to it, and you know that when you get scared, your hair stands up, right? You talk about that.
Right.
So it has to be activated through a nervous system. There's sebaceous glands who live nearby that are secreting oil to sort of help keep the vitality of the hair follicles, which unfortunately we lose as we age, right? Which is why the hair gets drier.
Right.
So, they're all sort of connected within this network, much like you think about a network in a forest, right, of plants and trees and so forth.
Hmm.
So they're all sort of working together and helping each other maintain that growth.
Such a great analogy. Do all the hair strands grow simultaneously or at the same rate?
So no. So you have essentially four cycles to the hair. The classic way we sort of think about it is that you have the growth phase, which is anagen. That's when the hair follicles are on the move, and you're sort of seeing them as they're exposed, right? But like any other cyclical thing in nature, our hair also goes through this cycle where you have a shedding phase, and that's called exogen, where the hair sheds, much as our skin sheds when it gets to the end point of its cycle.
Hmm.
And then you have a resting cycle where the follicles are actually resting and waiting to come out of hibernation. Think of it as being in hibernation, like a bear is in hibernation.
Yeah, that's good.
And it's sort of getting nourished and getting ready to come out. And then there's the catagen phase, which is that transition cycle. So between hibernation, the transition, the growth, and finally the shedding, there's this constant movement, but each of the hairs are in a different phase. So even though you may have up to around 300,000 hair follicles, not all of them are active. And so there are periods of time where a lot of my patients say, "Oh my God, I'm losing all my hair." No, it's just that the majority are going through that shedding
Hmm.
cycle, right? It doesn't mean that you've lost your hair, you're just noticing that. So, and of course, that's certainly tied into stress being a factor. And then if you're getting into that chronic phase where you're losing more hair follicles than you're gaining from the growth,
Mm.
right? Then potentially that's the response to the hormonal mechanism, where in men you have a male pattern baldness where testosterone sort of interferes with that and sort of, does not allow the hair to grow, or you're going through a menopause where there's other hormonal mechanisms in play that sort of where the hair is not able to maintain its growth rate, the growth cycle.
Yeah, so that kind of leads me to my next question about what does the word alopecia mean? And we know that both men and women can suffer from it. Is the etiology different between the two? And we're hearing a little bit about this.
Yeah. So men, we know a lot more. Clearly now we know there is a role for testosterone, which is the major male hormone. But also women can have hair loss because women also have testosterone. We tend to sort of connect testosterone with men and estrogen and progesterone with women, but it's actually
Right.
the ratio and the interplay between the two that drives a lot of the functional outcomes in the two sexes.
Hmm.
So men need some portion of estrogen as well, and women need some portion of testosterone. And that ratio is key, which is why I was mentioning earlier women going through menopause and men going through andropause, the male version of menopause is andropause.
Hmm.
You're going to see these changes in how even someone that doesn't lose hair, they're still going to get that thinning, the gray, white, drier hair that tends to sort of, flay and split off easier. So those are sort of some of those things that we know hormonally can interact. And of course, that means as doctors, we can now understand how to better intervene in some of these steps and move the needle the other way towards enhancing the hair population.
Yeah, makes great sense.
One of the concerns I have about what's happened with social media and, your average person going on social media and like doing a search on alopecia and saying, oh, that's my treatment. Well, actually, the most important thing you can do is go to an expert. You have to go and seek a board certified doctor who will do the initial diagnosis. Please don't diagnose yourself. So let's talk about alopecia. Alopecia essentially means baldness. It's a medical term for baldness. But there's different types of alopecia. You can have alopecia totalis, which is a purely genetic phenomena where you literally you do not have hair on your scalp, even on your eyebrows. There are various degrees of it, so you need to be diagnosed for that. There's alopecia areata, which is something that we see with young people where you get patchy loss of hair in your scalp.
Mm-hmm.
And that doesn't necessarily mean you have the male pattern baldness, right? So, and then there's androgenic alopecia, which is sort of the testosterone driven male pattern baldness that has this typical pattern of losing hair, usually in a frontal hair. Your hairline sort of recedes. At the next stages, the hair follicles in the crown are lost, and then you get sort of this movement of this horseshoe pattern around your hair where you sort of have lost it. So that's a typical male pattern. But the most important decision you have to make is to know you have the right diagnosis, which means you have to seek, I would say the people who really are the experts in the field are either board certified dermatologists or board certified plastic surgeons who have studied the field and understand how this works.
Yeah, I think that's important. That's good to know. And for particularly the hormonally induced alopecia, is that always considered permanent? Or if there was some manipulation of hormones in the patient, would that change the outcome?
Well, we're certainly learning more and more. I would say the field is probably about 50 years old, and it started by the first medication that sort of became mainstream was minoxidil, which is really a
Yes.
blood pressure medication. But in the process of managing patients, they noticed that actually, it had an effect on keeping the hair in its active cycle.
Mm-hmm.
The good news with it is that we know it works. We have about a 40-year history with this medication. And we're not a place where you can just go to your local CVS or Walgreens and you can get it off the shelf.
Right.
So you don't need, it used to be a prescription drug. The bad news is that it's not a cure. It is a treatment. In other words, if you come off the minoxidil, you're going to lose this effect. So you have to maintain yourself on it.
Yeah.
It is a topical medication for men at 5%, for women at 2%. We do tend to work the concentrations depending on how well it's tolerated. But there is a subset of patients, interestingly enough, that may not respond to that topically and they may need to take the pill form.
Is there any blood pressure effect to that if they take the oral form?
No, the doses are so low that it's not really going to be a player at managing your blood pressure. So that's why we like these drugs as topical medications
Yeah.
because you're sort of minimizing a side effect. The other side, again, as you know, as doctors, we're always looking at both sides, right? What are the pros? What are the cons? The cons are that if you're doing a scalp method, you may not get as good of an absorption. Different people have different absorptions.
Oh, yeah.
Whereas we know when you swallow a pill, it's going in your bloodstream, right? So we have to sort of look at that pros and cons with each of our patients and see. But again, the downside of a pill, it goes in your bloodstream, but you're also going to have some of the side effects,
Yeah.
right? We have to always manage those two sides.
Well, now you helped us understand some of the locations that males typically have in terms of how their baldness may progress. What about females? Is it a similar pattern to male pattern baldness, or what areas of the scalp seem to be most involved, either in terms of complete baldness or thinning of the hair? Are there particular spots that are just always a problem for women?
Yeah, for most women, it's really a general thinning.
Hmm.
There's no particular sort of pattern where you're like, okay, so I mean, what we see with women is a general thinning. And then we have to be very careful of ruling out some of the other potential mechanisms, such as, thyroid imbalance,
Sure.
right? So we know that, for example, if you're hypothyroid, you could have changes in your hair pattern. If you're polycystic ovarian syndrome, for example, that causes an imbalance in your hormones, and that could sort of cause overgrowth of hair on body parts and then undergrowth of hair on your scalp, right?
Hmm.
So it's really important. Again, I cannot stress this enough, that please don't self-diagnose yourself. Don't try to get these medications online, even though it may seem easy, that some guy pops up and says, "I'm going to give you a prescription." You're not doing yourself any service by doing that. You
Yeah.
want to have the right diagnosis. You need to understand, if you have not been worked up with your thyroid and hormones, that's of primary importance to make sure you have ruled that out. There's also, by the way, some immune related syndromes. There is some that can cause scarring.
Mm.
So for example, in those settings where you have lost the hair, you want to get a biopsy by your dermatologist and have that be read to make sure that it's not an immune driven mechanism,
Hmm.
because then you got to manage the immune system for attacking the hair
Yeah.
follicles, right? So all of these have their own. It's not as simple as the marketing people on social media want to make you believe, that you just got to, take some hairspray and everything's going to be perfect, right?
That's excellent information. Well, you started to talk about this a little bit with minoxidil, but before we get into the cool stuff that you're doing now to treat hair loss, what have been the older treatment options? Maybe before you were doing isolated hair follicle transplants and before exosomes and things like that. What were some of the older things and what were the limits of those?
Yeah, I mean, as you can imagine, like anything else in medicine, everything, including snake oil, was used to.
Right. Yes.
I got one of my favorites was one of my patients who came with his mom, and the mom sat there very quietly, listened to the consultation based on what I was advising, and she's like, "Well, these are all medications, right?" So yeah, she's like, "I still don't understand why he doesn't let me just use raw egg
Oh, what?
on his scalp."
You're kidding.
Because I know that. So when you say what are the remedies, there is all kinds of remedies.
Yeah. Yeah.
Uh,
Oh my gosh. I've never heard that.
Raw egg, a raw meat,
Really?
putting raw meat because it gives your head protein.
Oh.
So there's all kinds of old wives' tales in terms of what should be done. But I would say there's essentially four buckets to think about.
Mhm.
There is the non-prescriptive things you can do, right? There is the prescriptive things, which is sort of what's prescribed by a doctor, right? And then there is sort of the stem cell related things, which are sort of coming from your body and isolating cell mediated signals to your hair follicles. And then last but not least, the surgery, which is to completely replace your hair follicles by a graft from another place, right?
Yeah.
So within those four buckets, we can talk about, you know, each of them sort of, we can go from there.
Yeah. Yeah. Well, let's get into the good stuff. And thank you for organizing it that way. That's very helpful. Would love to talk about basically what each of those options potentially entail, and then how you decide what is best for any individual person, like, who needs what. I mean, there is, I'm sure, a set of criteria that you have for who would best be treated this way or that way. So, what are your thoughts about that?
Yeah. Well, I think, I mean, as I said, first thing, see an expert, get evaluated, make sure you have the right diagnosis. Then that doctor likely would want to make sure that your labs are within normal. And some of the things that we know within the bucket of non-prescriptive are simple things you can fix. Like if you're hypothyroid, seeing a specialist, getting your thyroid back to normal. We know this is research that goes back to the 60s, where they looked at malnourished people
Mm,
and they found that zinc deficiency, for example, is a big driver for hair
good
loss,
point.
right? So understanding the vitamin deficiencies and the nutritional selenium, some of these things are we know that once you fix that deficiency, that's a simple thing. But if you don't know, you're not going to know, it's not going to respond. No matter what you do, it's not going to respond.
Right.
So that's sort of in that category. Then you have within the world of herbal support, like saw palmetto, for example. We know that's a supplement that does help with hair. The evidence is weak, but it is there. The claims sort of have not been scientifically tested per se, but we do know for what is out there, there is positive influence and not as much negative. So that's within that category, right? So managing your nutritional status, vitamins, some things like within the world of herbal supplements. And then moving on within the prescriptive domain, we talked about the first one, which is minoxidil, which is well documented. And then the next really phase, I would say, over the past 25 years, which has been very well documented and well researched, are the alpha reductase inhibitors. So you have, dutasteride, finasteride. These are prostate medications that we know can essentially block the ability of the testosterone to cause that male pattern baldness. So to essentially block that. So these are prostate medications. They're well studied within the world of urology. Essentially, it's a side effect now. It's primarily being used at low doses for young male patients. But again, we mentioned this earlier, every drug has its pros and cons. So the question is, what are the cons? Well, the cons are there is a sort of emerging literature in urology about a potential finasteride effect, which is men that are reporting having depression or lack of sexuality. It's a small percentage, but unfortunately, the science is not clear as to whether it's reversible or not. Some men are reporting that it's actually not reversible.
Sure.
So I think that, again, that's one of those things that I believe that please don't just go and order this stuff online. You really need to be checked out by your doctor. And I think it's important to have a urologist, especially for men that are going through a fertile age, to understand the pros and cons of these drugs and what it means from a sexual health function versus, a cosmetic endpoint, which is to make sure your hair is intact versus your prostate over time, the risk reward based.
Yeah, that is very interesting. That helps us understand some of the prescriptive treatments, as you say. And then what would be the next consideration?
So the next consideration is the group of patients, mostly younger patients and mostly our female population, who are starting to notice hair loss, but they haven't lost the hair yet. It's mostly thinning of the general population of the scalp.
Mhm.
And what's important for a younger population that are listening to your podcast to know is that hair loss doesn't happen when you see it. Hair loss actually happens when you're a teenager, when you don't notice it. So the entire process is actually happening almost for men at the time of their puberty, but you just don't notice it, right? So if you have a couple 100,000 hair follicles and you're missing 2,000, you're not going to notice it. But when you miss 20,000 at 10% loss, you're like, okay, what's happening?
That's a great point.
Right? So this is actually starting very early. So it's just not picked up until, these guys are in their 20s when they're either noticing the receding hairline or they're just noticing that you can see through the scalp, right?
Yeah.
So with that population, that's really important for us to catch them early. And it also happens to mimic sort of the population of women that tend to be in middle age. And let's say if they're hormonally, they're good, everything else has been checked out, that they're starting to notice genital thinning. So with that group, what we like to do there, again, within this world of stem cells and what you can do, you can break that down to 3 different buckets. So the first one is essentially using your own blood and plasma and separating that. Either you're using platelet-rich plasma, so the PRP, or you're using fibrin, which is another component that can drive the stem cells. And that's just a simple blood draw, processing, and injecting it into the scalp.
And it's your own stuff, which is nice. Yeah.
Yeah, exactly. We're not worried about any infectious etiology. We're not worried about you having a reaction. We're not worried about your immune system causing a deleterious effect or, harming you in any way. And it's actually very quick. The current ways of managing and processing is relatively quick. So within 15 minutes, you have what you need in your hand and you can go ahead and just do a series of injections to the scalp.
Just to clarify for the listeners, so you inject the problematic scalp areas and distribute the PRP. Is that correct?
Yeah, if I have a young guy who's come in and let's say, I have a lot of young guys who are in their earlier 20s. They're in college or just graduated from college. There's a number of them that we see on a regular basis. So for someone like that, actually, I don't necessarily focus on the area that we've looked, because again, remember I mentioned to you, this has been ongoing for a long time.
Yeah.
So I'm actually playing the long game of preventing more hair loss. I want to sort of, nip this in the butt early on. So I'm actually applying it to the entire top portion of their scalp.
That's excellent. Yeah.
Yeah, so that's sort of the first level where it's quick. The whole thing takes from start to finish takes about half hour.
Hmm.
There is no recovery associated with it. You walk out as if nothing happened, and you go back in your life. Now with those, you have to do a series of these. So what I tell everyone is like you're going to the gym. You don't go to the gym once and you're like, how come I don't see a six pack?
Hmm.
Right? You have to dedicate yourself to stress the body to see a response. Right? So that cycle, if you do all the right things in the gym, it's going to take you at least 6 weeks and really 6 months to see the outcome, right?
Yeah.
Same thing with this. You're going to see that initial effect maybe at the 6 week mark, but remember the resting phase for some of the hair follicles is up to 9 months. So the hair growth cycle really happens over a long period on many, many months.
Hmm.
So we tell our patients that you got to be patient with this on a scale of 6 to 9 months to see something.
And you really need maintenance treatments, is what you're saying. So,
Correct. So we start out by doing this as a cycle of every month for 3 months.
hmm,
And then if we're seeing good response, then we'll sort of switch to every 3 months. And if we see a good response to that, we go to every 6 months and then possibly once a year.
nice.
But I think most people sort of end up being somewhere in coming in once they're on a regular cycle, they're coming in like twice a year just to maintain what they have.
Yeah. Gosh, it's a small price to pay for the results you get. So that's really lovely.
So that was level one within the stem cells. So that's been something that's been around for a long time. What's really exciting, which is really primarily driven by a lot of excellent plastic surgeons in our field, is the second category, which is exosomes. And exosomes are essentially intracellular signaling mechanisms for the body to differentiate and grow. And guess what has a very high concentration of exosomes? It's fat cells. And guess who owns the fat cells with understanding how to harvest it appropriately and process it? That's plastic surgeons.
Hmm.
And so that's sort of a very exciting area in our field.
Yes. Yeah. We just did an episode not long ago about exosomes. So this is very timely that we're talking about this.
Perfect. So that, yeah, that's a nice addition, sort of as that I'm sure you've provided a baseline of understanding. But in our world, we use fat-derived exosomes. So I think the reason, again, why it's important to have a board-certified plastic surgeon address this is because plastic surgeons understand three parts to this. It's not just, hey, I'm going to take some exosomes and stick it in you. It's actually how you harvest the fat, very important,
Hmm.
because it has to be done in a very atraumatic way, which plastic surgeons know what to do. The second part is how you process that fat, because you have to be able to process it to get to the exosomes. Otherwise, you're sort of hoping, and if hope is not going to get you there, if you end up with a full fat cell, an intact cell, it's not going to work. So you actually have to get inside that cell, and the plastic surgeon understand the mechanisms to do that. There's various mechanisms, whether it's through digestion, through mechanical agitation. There's different ways to get there, but understanding how to get that will get you the highest number of stem cells. And then last but not least is how you apply it in a way that allows you to predictably get the response that you want,
Hmm.
right? So that requires a little bit more because I have to sedate my patients. I just want them to be comfortable. So, they're coming to the office, I'm sedating them. I'm getting about a couple tablespoons of fat, processing that, combining it with the PRP concentrate,
Hmm.
and then injecting that into the scalp for a much higher level of stem cells. And then that, of course, brings up the third level, which is, well, what if I don't have any fat on my body, right? So for that particular subset of patients, we actually go into their bone marrow. So we have a mechanism by which, under fluoroscopic guidance or under X-ray, we actually go inside the bone marrow and literally grab the stem cells from the bone marrow, which is where the source is, process that and inject that. So that has the highest level of stem cells, obviously, because you're sort of literally going to the source.
Yeah. It's fantastic. Yeah, so increasingly invasive, if you will, but still effective, which is lovely.
Correct.
For the listeners, what are the stem cells doing to the hair follicle? How would you describe what the effect is from stem cells?
Yeah, I think the concept is that we're still learning a lot about this. I mean, this is like one of these burgeoning areas of science and medicine. It's exciting because we're seeing the change, but to sort of make it predictable and say, hey, if I'm going to put it in Dr. Nouhan, I expect exactly 24% change, and if I put it in Dr. Alizadeh, there will be 36%. We're not at that stage where we can predict exactly how this is going to play out.
Mm-hmm.
What we do know that is that you are going to get a response. How much of a response is really based on the genetic potential of the patient and the stem cell induction on the doctor's part.
Mm-hmm.
Again, the best analogy that I can give my patients is you're going to go to the gym, you're going to stress your body, and then you're going to get a response, right? So obviously, the more days you spend in the gym, the more of a result you're going to see, right? It just makes sense.
Mm-hmm.
If you're there 5 days a week, you're going to see a lot more than one day a week. So that's that going from my PRP to my bone marrow or exosome, right?
Yeah.
On the other end, if I take a bunch of us that are, let's say we take a bunch of 50-year-old people and we put them in the gym and have them do the same regimen, they're all going to have different outcomes.
True.
And that's not based on their genetics. So they're doing the exact same regimen, right? Same time, same workout, but they're all going to have a different response. So that is that component that I tell the patients, we're going to do this. You're going to see how much of a response I can only tell over time,
Mm-hmm.
right?
Absolutely.
Much as when we do the exact same surgery on our patients, how they heal, a lot of it, right? Same sutures, same technique, but different patients heal differently, right? I can't predict exactly how you're going to heal, right?
So true.
But I do know you are going to heal. And I do know you're going to have a response to what I'm going to put in there. So that's where we're at now.
Great. Well, that's a good explanation. And then once you look past some of the injectable stem cell related treatments, then we come to surgical treatment, hair follicle transplant. Or why don't you tell us a little bit about where we are with the technology?
Sure. So, the hair transplant field is relative. I mean, when you think about medical things and surgical things, there's 1,000-year-old history of medicine and surgery, whereas this field of hair transplants is about maybe 50 to 60 years old, right?
A relative newborn.
Yeah. So, what's been amazing is this incredible sort of S curve logarithmic understanding of how you can manipulate hair follicles to get the more natural results. So what we know, looking back at a lot of the celebrities back in the 70s, they all had that dull row hair, going with very clear plugs. They call it the hair plug.
Yes. Or strips.
Exactly. Well, it started by dermatologists essentially taking a punch graft
Yeah.
and putting that as a punch graft in a new place. And then the problem with that was that it's very obvious that you had this sort of things where,
Yes.
and then with time, what we learned was that actually hair follicles sort of tend to live within family units, and those family units could be 2, 3, or 4 follicles that are sort of one could be a little bit higher, one is shorter, and if you understand that, you can move them as that family unit,
Mm-hmm.
right? So that we call that the follicular unit. So number one, you have to understand how to extract it as one. So you're going to take that entire. So imagine you have a family unit of a dad, a mom, and a boy and a girl, right?
Mm-hmm.
So they all look different. They don't look exactly the same. So the problem that we're having was that we're putting identical things, and that looks terrible. But if you do that diversity of mom, dad, daughter, son that have a little bit of a different characteristic as a unit, hence called the follicular unit extraction, FUE.
Mm-hmm.
If you harvest it as such and put it as such, it actually looks a lot more natural.
Yeah.
That embodies our current means of how we do this operation, which is number one, let's talk about the donor principle, which we know as plastic surgeons. If I take fat from your butt and I put it in your breast or your face, it's still going to live as if it belongs to the donor site. So, right? So if I take a hair from the back of my head and put it in the front of my head, that hair follicle is still going to think it's living in the back of my head, so it will keep growing. Because the question is, well, why doesn't it stop growing? Well, because it still believes it's coming from the back of the head, right?
Mm-hmm.
So that's where we take it from the back of the head. The second principle is that we don't want to take from Peter to give to Paul and have both of them be in bad shape,
Truth.
which means that if I have 10,000 hair follicles in the back of my head, I usually only want to take 10 to 15% because that's not noticeable. We've done the studies and we know once you get to like 20%, of removing those as a donor, you actually start noticing thinning in the back. So you've really not done yourself any favors, right?
Yeah.
So the donor is just as important as the recipient. And so we want to keep as much donor availability around,
Hmm.
which is why we limit it to 10 to 15% of the donor. Move those, as we talked about, as a follicular unit extract. And then the next part, that is a nuance, and again, why you need to see the right surgeon for this, very important to understand the aesthetics. There is how compact things are in the front, and then the orientation of the hair changes, right? Which is why people tend to side their hair one way or the other.
Yes. Good points.
Yeah, so actually, as you go towards the vertex of the head, you see that with the newborns, they have sort of this circular pattern,
Hmm.
right? So you have to really, to get the best cosmetic result, as you know, as a plastic surgeon, cosmetic surgery is the art of being able to hide things and do it in a way that sort of is inconspicuous. So that's part of that idea of concentration, orientation, how you divide that up and how you put it in makes all the difference with your final outcome.
Yeah. And there are refined ways of extracting these follicular units now, aren't there? Can you tell us about some of the automation and how that works?
Sure. So, again, that's its own major revolution in the past decade, I would say.
Hmm.
So we've gone from hand-based, what's called strip grafts. You used to take a strip and then just cut up those pieces under a microscope. And now it's gone to an automated form. There's, various tools like a neograft that essentially allows you to automate that process, take those follicular units, wash them, spin them, separate them so that you know what goes where. And then last but not least, there's a robotic approach to this with artists and some of the other robots that are available that sort of map out the head. I would say that, if you talk about what is the future of this field, I think there's two exciting areas. One is using AI, right? With understanding artificial intelligence, you can actually use protocols that you can sort of predict based on the scalp shape and the surface area what the need is going to be,
Yeah.
and then how you can take that donor, separate it, segregate it, map it out, and then administer it, right? So that's one.
So cool. That's fantastic. Yeah.
Probably, I would say we're 5 years away from being there. We're not quite there yet.
Hmm.
And then the other exciting area is culturing hair. So the research now, we're at a phase where there is great research to show that we can take a singular hair follicles and culture it and get thousands of those follicles, so that we're no longer dependent on the donor site. But we're not there from a clinical standpoint of being able to grow it and preserve it and put it there.
Reliably. Yeah.
Correct. So we're probably about 7 to 10 years away from being able to do that reliably.
Yeah. So exciting, though. I mean, when that really gets well developed, it's going to be a game changer. That's fantastic.
Yeah. So that's why it's an exciting field, right? You sort of have your hands in all these different interesting things that are going on.
Yeah. I just love it. Could you tell us where the follicular grafting is done, how long it takes? Is it painful? I think people are curious about what really happens.
Sure. We're at a stage now with this procedure that it's really outpatient, easy, minimal recovery. And by that, I mean you can come in, you do not need general anesthesia. We usually give our patients a couple of pills to help relax them. And then we go ahead and numb the area of where we want to extract our follicular units, and then the area where we're going to be putting it. So that's a very simple, few minutes, and then your scalp is numb. So our patients are awake, listening to music. They pick their favorite music. The one thing I would say that's important is, don't think that if someone says I do this the fastest, that means they're the best. Fast doesn't necessarily mean best. This is something you actually want to take your time.
Yeah.
There is a lot of design element in how you want to execute this.
Yeah.
And you do want to take your time in terms of how you put these in, as we talked about with regards to density, orientation, and application of these grafts.
Yeah.
Because we want to be able to drive the survival rate of these follicular grafts. So we tend to, on all our patients, we do stem cells and we actually float the hair grafts in the stem cells, because we want to make sure that number one, they don't dry. So remember, like some of these chop shops that you go to where just taking it, putting it in a place and then putting it in, right?
Hmm.
So they're just trying to drive numbers. So it's important. My view is that you're much better off going to a boutique practice that is just you. They really are paying all the attention to you. You're the case of the day,
Yeah.
not like 10 people that are sort of, in an assembly line. So I think, there is this competing thing that's happening. I'm sure you've heard about Turkey. Who hasn't, right? Everybody's going to Turkey to do it.
Yes, yes, medical tourism.
Correct.
People, men in particular, going to Turkey for their follicular grafts.
Yeah. So I think the pros and cons of that are, yes, it's cheaper, but remember, you're sort of a commodity, right? You're sitting there with dozens of other patients and they're just get them out.
Mhm.
And also you have no follow-up.
Yeah.
And if there is an issue, what are you doing? You're getting back on a plane and going to Turkey? You're not. So I think you have to really weigh the pros and cons of going to a local person or someone in the US at least, where they still feel responsible for your care during and after, versus some of these other options, right?
Yeah, and some of those subtle things you're talking about can really affect your success rate, so I think that's a point that's well taken. Just a couple of practical things for patients who've undergone follicular unit transfer. What is the time period it's safe to assume they can tell whether or not they've had a permanent take of the new hair follicles? And are there some post-treatment activity restrictions or downtime? What do you tell patients?
Yeah, I usually tell them think about it as 1 week, 2 weeks, and then 9 months. So what does that mean? So 1 week is the week where you really don't want to make any visual appointments with anybody.
Yes, that's right. Might not look your best.
Yeah, exactly. So you're going to have some swelling. Most of the swelling is resolved by day 3 or 4.
Mhm.
But still, I just don't know. Again, everyone's different. So I want to sort of be safe and
Yeah.
conservative. So I say give yourself a week without any visual commitments. You're still going to have some scabs of where the grafts were placed. And that's the week 2 concept. By the end of week 2, those scabs have fallen off. So there's no telltale sign you've had anything. So if you're planning to be at an event or you're going to be in front of a camera, 2 weeks is usually a good general timeline where you're pretty much, there's no sign you've had anything done. And, by week 3, you can swim, you can sweat, you can do whatever you want to do because as you know, grafts, whether it's a skin graft or a hair graft, you have a good take by 2 weeks. You sort of know if it's in or not, right? It's going to be in place.
Yeah, right.
And then the 9 month number, the reason is because, as I mentioned, our hair sort of grows in these cycles. And by 9 months, even though you may be delayed, I expect to be seeing that first batch being in full glory by 9 months. And sort of you're going to be in your steady state by 1 year as to, what comes, what goes, and sort of you get to sort of see that. I think 9 months is a safe time for you to be able to see, okay, this is what it's going to be looking like.
Mhm. That's fair. And, as we've been talking about these different types of treatments, stem cell treatment and exosomes and hair follicle grafts and things like that, do you find that one category is more successful than the other in terms of improvement in, hair volume, thickness, etc., or even a combination?
Yeah, I'm going to go back to my gym analogy. So you don't want to go to the gym and just get on a treadmill and say, I expect to be great at everything. And you don't go to the gym and just do strength training and say, that's going to do it. And you're not going to go to the gym and not stretch and balance and do core work without it. So you need all three of it, right? You need cardio, you need
Mhm.
strength resistance training, and you need balancing and stretching to get the ultimate outcome. Same thing with this, right? You got to tap into all these different levers to get the best outcome.
That makes perfect sense. And then just one other aspect to look at. Does the age of the patient seem to affect the success rate of any of these treatments? And do you find that there are certain people who are just not candidates for these types of treatments? Is there ever a situation where you feel like, you know what, I just can't do this for you or you're not a good candidate?
Yeah, absolutely. Which is why you really patients need to see the right expert. So first and foremost, I need to make sure that I have ruled out any systemic, in the medical parlance, systemic means things that are sort of being driven through your body. So that could be your immune system that's reacting. It could be your
Mhm.
hormone levels that are off. So first we need to make sure those are in, because I could do all these treatments and I'm not going to see a result unless that underlying problem is fixed.
Yeah.
And then I would say that age is a big factor, much as if I take a 25-year-old guy and a 55-year-old guy and I give him the same exercise regimen, guess who's going to do better, right? So the potential obviously is more. And that's why with my older patients, I sort of don't give them a choice. I say, you know what, you have to do the stem cell along with our transplant because I just know you're not going to be driving that kind of growth as a young guy.
Wise advice. Well, I tell you, we have learned so much from you today, Dr. Alizadeh. Thank you so much for sharing your expertise and your time with us. Any final words you'd like to share? I mean, you've given so many pearls of wisdom throughout this whole interview, but anything you want to leave the listeners with?
No, I want to thank you for shedding light on this and doing it in a very, appropriate way, which is not driven by hype, but medicine and science. So I want to thank you because that's what we really need. There's so much misinformation.
Yeah,
And I think people need to listen to podcasts like this where they really can trust the knowledge,
yeah,
all right, and make good decisions. So thank you for that.
absolutely. My pleasure. And it was a pleasure to have you here. Thank you so much and take care.
Have a great day.
Well, that's our show for today. Hope you enjoyed it and learned something too. Don't forget to subscribe, rate, and review. Please share this podcast with someone else who might be interested. And while you're at it, check out the podcast website for related topics to explore. It's www.plasticsurgerydecoded.com. And as always, thank you for listening to Plastic Surgery Decoded.